Well, thank you all for joining me today. You know, Republicans have been trying to tell some big fat lies about their big awful bill, especially when it comes to health care. So we are here to set the record straight and to give America a stark warning. When Republicans lined up behind Trump and jammed through a bill they hardly liked and hardly even read, they didn't just vote to throw trillions of dollars in tax cuts at some of the richest people in the world. They also voted to throw working families to the wolves and throw America's health care into chaos. From cutting Medicaid, something they first said they weren't doing, and now are pretending they want to undo, to shuttering hospitals, something they first said would not happen, and then they said they could cover it with a Band-Aid, to approving Trump's sabotage of the ACA marketplace, something that will kick millions of families off their coverage, to refusing to extend healthcare tax credits, something that will send premiums skyrocketing, and push another 4.2 million people off their insurance. Let's be clear about just how big of a deal that is. Right now, these tax credits, passed entirely by Democrats, are saving millions of people across the country hundreds of dollars a month. In Washington State, we have over 200,000 people who are saving around $1,300 a year on average. But instead of extending that support for working class families, instead of putting health care first, Republicans put billionaires first. And now families are going to be the ones stuck footing the cost for Republicans' big ugly bill. And unfortunately, the consequences of Republican actions, which they keep trying to deny, are coming sooner than Republicans might think. Because while the health care tax credits they refused to extend may not expire until the end of this year, insurers are setting their rates right now. And when credits expire, rates go higher. Marketplace insurers are right now requesting the largest premium increases in more than 5 years. In Washington State, health insurers have already requested to hike their rates by over 20%, in no small part because of what Republicans have done, or rather refused to do. Combined with Republican ACA sabotage, that could push as many as 150,000 people off their health care coverage across our state. To say nothing of the people who will get pushed off Medicaid in 2027 and beyond. This is going to be catastrophic, which is why it's so important we sound the alarm for families about what is coming down the pike. And I want to sound the alarm for Republicans too. If you don't come to the table ASAP to fix this, you're not going to be able to spin your way out of this reality when over 15 million people lose their health care due to Republican health care cuts and sabotage. You are not going to convince them everything is A-OK when hospitals shutter because Republicans gutted their funding. You can't just pretend everything is sunshine and nothing's wrong. When insurance companies jack up premiums across the country and millions of families lose the health care tax credits that saved them thousands of dollars because Republicans refuse to lift a finger, you're not going to be going to get by sticking your head in the sand. You are the ones who put American healthcare on this collision course. You may try to ignore the warnings, you may try to ignore the voices back home speaking out, but you're not going to be able to avoid the responsibility. When premiums spike next year, I'm going to make sure everyone knows it's because Republicans chose to make healthcare more expensive. Not on accident, not for reasons unknown, but because Republicans decided to do nothing and let costs skyrocket. Because Republicans decided we can afford to shovel trillions of dollars towards tax breaks for billionaires, but we can't afford to help working families get their health care. They couldn't be more wrong. So I'm really glad today to be joined today by two speakers who are experts on the ACA tax credits, and they can lay out what their expiration will mean for families in Washington State and across the country. So I'll first turn it over to Jeanne Lambrew. She's with the Century Foundation. Jeanne, thank you so much for being with me.
Thank you so much, Senator Murray, for your leadership on budget policy, health policy this year and in the years past. I'll start by saying where we've been. Last year and the year before that, the United States had hit record high coverage rates for Americans. In large part, that is due because of the Affordable Care Act's health insurance marketplaces, which cover people with income above Medicaid eligibility, but people who don't have access to affordable employer coverage. The American Rescue Plan and Inflation Reduction Act improved those premium tax credits for the marketplace coverage. Specifically, they've raised the value of the tax credit and smoothed out the phase out, which resulted in enrollment growth of more than double. We now have 24 million people who are covered in the health insurance marketplace. It contributed to slower growth in premiums. It helped lower deductibles, and it actually increased the choice of plans. Back in 2020, people in the marketplace who had a choice of 3 or more plans were only about 2/3. Today, 98% of people have a choice of quality plans in the health insurance marketplaces. But we're about to see a dramatic change in that, as Senator Murray said. This is happening for 3 reasons. First, a Trump administration rule artificially lowers premium tax credits, limits when people can sign up for coverage, among other changes, and by its own admission would remove 2.8 million people from the marketplaces. Second, the budget reconciliation law would restrict eligibility and add onerous new rules for signing up for coverage and for staying covered, which will cause another couple million people to lose coverage. And importantly, while the budget law did extend all the tax breaks for corporations and for wealthy people that end in December, it did not choose to extend the premium tax credit for millions of low-income and middle-income Americans. So what will it mean if these tax credits end at the end of December and are not available next year? As the senator said, out-of-pocket costs will skyrocket for people receiving such tax credits. On average, for people in healthcare.gov states, that increase will be 93%. For example, for a family of 4 that earns about $64,000, that's a $2,400 increase in their annual payments for health insurance. And for an older couple just above this eligibility limit that will return in January, that new cost of health insurance could be $17,000 for a couple 60 years old who are just above the new eligibility limit about to come back into effect. It will disproportionately affect rural America, where costs tend to be higher because there's fewer employers that offer health insurance coverage. There are 2.8 million people in rural areas in healthcare.gov states whose premiums not only will go up, but will go up a lot more than people in urban areas by over 25% more. We know that 4.2 million people who work in small businesses or who work on their own, who are entrepreneurs, rely on the marketplace. They could lose their coverage. And we also know that this won't just affect people who get those premium tax credits. All people in these markets will be affected because fewer people will be enrolled. Those fewer people may be more costly, so premiums will rise for everybody. As the senator said, we're seeing proposed rates that are higher than they've been in over 5 years, 15% on average, over 20% in states like Washington State, in my state of Maine, states like Georgia. And in short, I think we'll see millions paying more for health coverage and millions more losing coverage. So with that, I will turn it over to Ingrid Ulrey, the CEO of the Washington Health Benefits Exchange. Thank you.
Jeanne, thank you so much for those comments. I'm going to echo some of those themes and also highlight more specifically what's at stake here in Washington State. And Senator Murray, thank you so much for the invitation to join you for this event today. So here in Washington, our state exchange serves more than 2 million residents. We're the front door to enroll both in the Medicaid program and for people to come in and purchase marketplace coverage. 3 out of 4 of our marketplace customers are leveraging these enhanced premium tax credits that we've been talking about. And as mentioned, that's more than 200,000 Washingtonians who are getting this extra help to afford their health coverage, and that's really important to them. People in our state who benefit the most, same themes as you just punched out nationally, Jeanne. It's our older residents, rural residents, people who work for small businesses, freelancers, gig workers, and just thousands of middle-class families. If Congress allows these tax credits, enhanced tax credits, to expire, people are going to be angry and upset by steep premium increases. Our actuaries predict that average net premiums will more than double, and in response, approximately 80,000 Washingtonians will make that really difficult decision to just drop their coverage. And as noted, this potential change is coming on top of the passage of H.R. 1 and CMS rules that have already landed, which together increase costs and just make it much harder and more difficult to get covered and stay covered in the marketplace. By extending the enhanced premium tax credits, Congress can prevent further harm. Here's an illustrative example from our data. So, for example, that we have a customer who's 60 years old, who lives in Yakima, Washington, works part-time, and earns a modest income of $45,000 per year. Because her husband just retired, she's no longer on his employer-based plan, so she buys on our exchange. With the enhanced premium tax credit, she's now paying just over $2,000 per year for coverage. Without it, she will pay nearly $4,000 per year. So for this couple, they may decide that's really just too much, and she could opt to just cross her fingers and hope nothing goes wrong until she ages into Medicare. And that's not okay. So timing is really critical here, and we need Congress to move quickly. Health carriers have already submitted their proposed premium rates for this year. As mentioned, time's running really short for us before the beginning of open enrollment, November 1. We will be sending renewal notices out to our customers starting in the early fall. And so if the Congress kicks the can on this issue into the later part of the year, it'll cause incredible confusion and chaos around health insurance coverage. So now is a key time to act. These tax credits are working. They're helping people here in Washington afford the coverage they need to stay healthy, and they're essential for keeping our health system and overall economy at large strong. So thank you again, and back to you, Senator Murray.
Thank you. Naomi, I'll turn it over to you to have the press ask questions.
Great. If anyone on the call would like to ask a question for any of our speakers, please use the raise hand function and we will go ahead and call on you. And I will give folks a minute to get their hands raised. And if anyone has a question and is not able to use the raise hand function, you can also just go ahead and unmute yourself to ask a question.
Yeah, hi folks, this is Mike McCall at Modern Healthcare. Can you hear me?
Yes, I can hear you.
Great. So your colleague to the south there in Oregon, Senator Wyden, said earlier today that he's not getting much sense of bipartisanship around this issue for trying to solve it. Is this something that you've been hearing anything about? I mean, you work a little bit more bipartisanly on the Appropriations Committee sometimes, or is this just something that's going to wind up as an election issue?
Well, Michael, here's the thing. So in the big, beautiful bill, the Republicans refused to extend this tax credit. We offered numerous amendments to do so. They defeated them. Some of them are now hearing, as we are, that premiums are going to go up and the number of people who have health care is going to go down. That will increase uncompensated care, meaning everybody's prices are going to go up, everybody's costs are going to go up, and as we know, jeopardize a lot of our rural hospitals and, of course, increase costs for everyone. We've been sounding the alarm on this. Senator Wyden has introduced legislation as well as several other people, but so far no Republicans have agreed to co-sponsor. As you just heard on this call, we're coming up really fast to this deadline where people are going to get their new insurance bills. They're going to try and sign up for the ACA tax credit they had before, find out it is no longer there, and this is going to be a real panic in a couple of months. So we are, again, pushing really hard to our Republican colleagues help us out. Join us here. You're in charge. You're in the majority. You can fix this problem before it descends on people this fall.
Thanks.
Now we have a question in the chat from Andrew with the Northwest Progressive Institute. Andrew says, do you see any opportunities in the appropriations process to mitigate some of the devastating harms from HR 1?
That is going to be very difficult to do because what we're talking about here is the tax credit extension and a number of the provisions that were put into law by the Republicans that will impact Medicaid in a year and a half. So it is not an appropriations request. Mostly it's a tax and it's a policy request that doesn't go through appropriations.
And I just might add one point that this is federal funding. The premium tax credits are federal. The way this is structured is federal. So in states like Washington and Maine and other states, there really isn't a chance for states to do anything about this. There's just not enough money at the state level to replace the federal funding, let alone begin to address the SNAP and Medicaid and other cuts that are coming down the line.
All right, we have some more time for questions. If there's any reporters on the call who would like to ask a question, you can either use the raise hand function or unmute yourself to introduce yourself and ask a question.
Naomi, if I may just add to Jeanne's comment about the challenge that we have at the state level, we cannot backfill this level of loss of federal funds. For Washington State, it's $285 million a year loss of federal funds. Our state leadership is committed to supporting coverage in the exchange and have appropriated a modest state premium assistance. But in the current state fiscal crisis and environment, there is no way they can backfill this level of federal loss compounded by other policies that also will withdraw federal funds from our state. Thank you.
Great. I'm going to do one last call for questions. If you want to unmute yourself or put a question in the chat, I'll do last call now. All right, seeing no other questions, I'm going to turn it over to Senator Murray to close us out.
Yeah, well, thank you again for joining us on this call. I think people are so unaware of the impact that is coming at them in a very few short months. Everybody needs to understand this, speak up, speak out, and help us fight back.